Is it too early to get a facelift at 41? Is it too early to get a facelift? Should I do fillers first? I'm overwhelmed at the options available and I don't want to waste time or money. Thanks for your time.
Thank you for your question. You're 41 years old and you're asking, is it too early to have a facelift? You've submitted some great photos that certainly help define what your issue is. As far as the question of the age and the timing of a facelift, I can tell you that I'm a cosmetic oculofacial plastic surgeon and board certified cosmetic surgeon practicing for over 20 years. And the although facelifting surgery for most of my practice is women over 45, the youngest patient I ever did a facelift for was a woman who was 37. A close second to that was a woman who was 42. And so what I can tell you is that it really depends a lot on what the situation is. So let's define what a facelift does. With the photos you submitted, you can see that there is a loss of definition of jawline. Well, if one of the goals of facelifting surgery is to restore the definition of the jawline, to lift sagging tissue from the cheek to the jawline to the neck. And so when we examine a patient as a candidate for facelifting surgery, we look to see how much they can slide up the skin. And a lot of times women will do this at home where they'll pull the skin up, and it's called the mirror lift. And if there's a lot of slide and you see your jawline improve, then you may very well be a candidate. You may not need an extensive full face and neck lift, but you may be a candidate for one of the smaller scar, limited incision types of facelifts. The one thing we cannot do with photos is we can't do a physical examination. You may be able to explore other options. In some patients who come to our practice, we'll do something like limited liposculpturing and reducing fat in the jawline so that you can see the jawline more clearly, as well as addressing maybe the indentation at the jawline. It's called a mandibular notch, and it creates an accentuation of the jowl. So we can actually fill that area with radiesse or filler. So you may be a candidate for a facelift, but you really should meet with cosmetic surgeons and learn about the options. You may be able to buy some time with just fillers by filling in some relative hollows and being able to kind of create the illusion of a more smooth jawline. Many of our patients who come to us who know that they will be having a facelift in the future are very often time limited, and so they don't have the time, let's say this year, because they've used a vacation time or whatever, and they'll do it maybe next year. But in the meantime, we can do a few things to strategically improve the appearance of their jawline. Sometimes it involves putting filler in the nasolabial fold or the cheeks so that they look more youthful and they look better. You know, facial aging, particularly in women, is very much accentuated in the lower facial area, the lower third of the face. So there are definitely more than a few options. But as I said, I would recommend you meet with qualified, experienced cosmetic surgeons who specialize in facial aging, and you can learn the options and develop a game plan that works for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.